Alhamdulillah wa salatu wa salam ala Rasulillah. Ladies and gentlemen, good day to you all. Today we are going to look into one condition which is diabetes mellitus. What is diabetes mellitus? What causes diabetes mellitus? And what are the ways through which we can prevent ourselves from getting diabetes? Diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia, which is higher blood glucose level resulting from insulin defect or insulin action or both. So, the blood glucose level is being controlled by the opposition action of two hormones, which is insulin and glucagon secreted by the pancreas. In our body, there is one particular organ that is called pancreas, and this pancreas secretes many hormones, which are insulin, glucagon, somatostatin, and pancreatic peptide. But our blood glucose level is being controlled by the opposition action of these two hormones, which are insulin and glucagon. This is what happens when an individual takes food. When food is ingested by the mechanical action of teeth is going to enter into the stomach via the esophagus. A lot of enzymatic activities take place in the stomach where food is going to be broken down into smaller particles. The end product of carbohydrate, which is glucose, travels into the small intestine where it being absorbed into the blood. Presence of glucose in the blood causes rise in blood glucose level, which sends signal to the pancreas to secrete hormones, specifically insulin. Insulin causes reuptake of glucose, where it converts glucose into glycogen and to be stored into the body tissue like liver, muscles, as well as adipose tissue. So this is what happens when our blood glucose level is low. The opposition action of these two hormones are the one responsible for regulating our blood glucose level. In diabetes, what happens is that it's either this insulin is produced in insufficient amount or our body become resistant to this particular hormones. The signs and symptoms of diabetes mellitus are three P's. These are the most noticeable signs and symptoms, which is polyuria, frequent urination, polyphagia, which is excessive hunger, polydipsia, which is excessive thirst, but fatigue and other some signs and symptoms may be noticed. The risk factors or causes of diabetes are we have obesity, age, physical inactivity, pregnancy, genetic factor, dietary factor, pancreatic pathology, hormonal disorders, and so on. So these are some risks or causes of diabetes mellitus. The way through which we are going to prevent ourselves from diabetes mellitus is that number one is eating healthy diet, that is to take food that contain low or small amount of sugar. Number two, we have physical exercise. Number three, we have regular medical check-up. Number four, maintaining healthy body weight. Number five is avoid smoking and excessive alcohol consumption. Number six is manage stress effectively. So thank you. My name is Mustafa Slema.